Okay. All right. So first of all, I just want to welcome everyone for joining us at 8 p.m. on a Tuesday night. We really appreciate everyone's attendance. My name is Emma Conron, and I am a registered physiotherapist and pelvic health therapist. And today I have my fellow physiotherapist and colleague Tess Crusp. And then we're very grateful and happy to have Dr. Lisa Liang join us tonight as well. Dr. Lisa Liang is a sports and exercise medicine specialist and a family doctor. Today, we're going to be talking about pelvic health in the childbearing population. Some topics we're going to be going through today are what is the pelvic floor and changes to the pelvic floor in the body during pregnancy. We're going to be talking about pelvic health physiotherapy and reasons to see a pelvic health physiotherapist. We'll be talking about reasons to see a physician, both during pregnancy and postpartum, and same with a pelvic health physio. And then we're going to be talking about exercise during and after pregnancy. So a lot of the topics that we're covering today, I'm being told I'm super loud. If I'm too loud, you can turn your volume down individually on your computer as well, if I'm blasting your screens. Okay. So as I was just saying, a lot of the topics we're covering today are focused around pregnancy and postpartum, but a lot of the themes are relevant to any woman as we age and have other different forms of pelvic floor dysfunction. So we'll be talking about that as well. If you have any questions, feel free to write them in the chat as we go along. And we will be checking the chat at the end of the webinar today, and we'll answer your questions at the end. But feel free to type them in as we go along. So I'm going to pass the floor to Tess, and she will start us with the content.
All right. So we're going to just do a quick background on the pelvic floor, just in terms of like general anatomy, basic roles in the body. We won't bore you with too many details here. But it's just good to have a general understanding of kind of where it is and what it does. So the pelvic floor just refers to the group of muscles that sits on the underside of our pelvis. It's kind of almost shaped like a bowl. And you can imagine that sitting in that bowl, we have all of our pelvic organs. So it helps to support those organs and just adds the overall stability of our core and of our body. One of the super important functions that the pelvic floor has as well is to maintain continence, which just means prevent any type of leakage. But it also does a whole lot of other really great functions like regulating pressure in the pelvis and just contributing to sexual function, things like that. So with the pelvic floor, we tend to see two main forms of dysfunction. That's what we would be assessing for. So one of those is hypertonicity. That just refers to an overly contracted or tight pelvic floor. And the other would be hypotonicity, which just refers to that lower tone or like really overly lengthened muscles. So both of these can kind of present as a weak pelvic floor though. So tight does not necessarily mean strong. That's important to keep in mind as well. The exercises and the treatment for both of these forms of dysfunction are going to be super different from one another. That's why it's really, really important to get a proper assessment done by a pelvic health physio to get a good idea of what you should be doing and what you shouldn't be doing. So in the instance where there's maybe hypertonicity or that increase in tone, right, we have a lot of high contractility, a lot of tightness in the pelvic floor, giving Kegels could actually make that problem worse. So that's kind of a scenario that we want to avoid. And I think that Kegels are often just thrown out as like every woman should do Kegels, but that's absolutely not the case. So it's really important to get checked out, make sure that you have the proper program, what that's appropriate for you. Okay.
Great, so the pelvic floor muscles in general work a lot harder than normal during pregnancy, obviously because the baby's growing and things are sort of shifting around. But also because of the fact that, there's obviously changing levels of estrogen and progesterone, but also another hormone called relaxin. So that actually causes ligaments and muscles to be a lot more elastic in pregnancy and causes increased laxity throughout your whole body, but also specifically in the pelvic floor, as obviously your low back and your pelvic floor sort of have to expand to accommodate the baby. So in terms of the pubic symphysis, so that's actually the spot between your pelvis pelvic bones at the front there that we were discussing in terms of your pelvic ring, that does have to expand during pregnancy about 3 millimeters. And actually, if you have a vaginal birth, it will expand more because it actually does have to separate in order for the baby to come through. So a lot of pressure through that pelvic ring and the low back. Obviously, going through a prolonged labor as well can also add to that pressure. The good news is most of the time that chronic separation is super, super rare. So most of the time that pelvic ring will come back, and it just takes time again for it to sort of return back to normal after pregnancy. So in terms of healthy weight gain during pregnancy, typically most women stay pretty stable, and you might actually lose weight in the first trimester because of nausea or vomiting or food aversion, and that's actually okay. So you just want to count your weight gain from the lowest point in your pregnancy or pre-pregnancy if you did not lose any weight. And weight gain should be pretty steady around starting around 14 to 16 weeks or so. You should start to gain about half a pound to a pound a week, and your midwife or family physician or OB will measure your weight every time, and they'll also measure your growing bump to make sure everything is according to the dates that it should be. So typically the most weight is gained in the third trimester. It's really important to note that you're not eating for 2. So obviously you just want to increase your calorie intake by about 300 calories a day, depending on how active you are. But usually it's about 1 snack a day or a slightly larger portion at 1 or 2 meals a day. So if you were a healthy weight pre-pregnancy, your goal is about 25 to 35 pounds. They use the BMI, which is not 100% accurate, as many of us know. If you're a little bit more muscular, sometimes you might be, overweight or obese on the BMI scale. But just kind of gives you a rough idea as to what to gain, and the range is about 10 pounds. So really, there's a lot of variation there. And remember, it's not all baby as well. So obviously, we don't give birth to 20-pound babies. So there's a lot of amniotic fluid, also blood volume, breast changes, placenta. So all of that comes into play as well. Most women return to their pre-pregnancy weight probably around 4 to 6 months after pregnancy. So these are just some examples of what 300 calories might look like for different people. Again, adding in, a healthy snack. Sometimes seeing a dietitian might be helpful if you're having, trouble gaining weight. Again, this is something that's really important to do. And, some women have a fear about gaining weight, but the biggest thing is to gain it sort of gradually over time, just kind of monitor it. Again, try to avoid eating too late at night, those sorts of things. And just try and slowly, gradually gain weight in a safe and healthy way. So reasons to see a doctor during pregnancy or see your midwife during pregnancy would be just routine prenatal care. Typically, you'll see them about every 4 weeks or so up until 28 weeks. And then it'll be every 2 weeks, and then every week once you hit term. If you have any questions about nutrition or exercise, obviously it's good to check in. Back, pelvis, or hip pain, very common, but not part of normal pregnancy. So aches and pains here and there as your baby grows is normal, but if you have a consistent pain, obviously chat with your midwife or family doctor about this. Really important to note that incontinence and hemorrhoids is not a part of normal pregnancy. So a third of women do have these symptoms, super, super common because again of the increased pressure. Lots of women have constipation during pregnancy. So very, very common. But again, if you do have these symptoms, it is very treatable in pregnancy and actually also very preventable. So it's important to get on top of these symptoms early on. Once they become more chronic, it is a lot harder to treat. Obviously see your healthcare provider if you have any general health concerns outside of pregnancy, and then there's just some red flags there to be on the lookout for if you have any of those. Seek medical attention sooner.
Okay, so we've made some comments about the pelvic floor. So I'm just going to talk a little bit about pelvic floor physiotherapy or pelvic health physiotherapy. So pelvic health physiotherapy is a specialized field of physiotherapy focused around treating dysfunction of the pelvic floor muscles. So Tess alluded to this briefly earlier, the hypertonic or the tight pelvic floor, or the hypotonic or the lengthened or weakened pelvic floor. You'll hear pelvic health and pelvic floor used interchangeably when referring to that form of physiotherapy or towards ourselves as pelvic health physiotherapists. I personally prefer the term pelvic health because we have a role not only in just treating the pelvic floor muscles, but how our whole body influences how these muscles function and how that impacts our overall health and how we deal with pain and how we're functioning. So we also have a role in providing education on biological and lifestyle factors that contribute to these symptoms. So pelvic health therapists, such as Tess and myself, we are registered physiotherapists. So we have our master's degree in physiotherapy, and then we've completed additional postgraduate training in pelvic floor rehabilitation. And then we're rostered with our college. So for this case, the College of Physiotherapists of Ontario, and we are rostered to perform internal examinations. So this is what really sets us apart from other rehab and fitness professionals in this area. So I'll just talk briefly about the internal exams because I feel like a lot of women who come to see us have a lot of questions about this. So the internal exams are not a mandatory part of our assessment, but it is recommended. And Tess again kind of made a comment to that because until we can actually feel those muscles, we don't have the ability to tell whether they are tight or whether they're lengthened. So sometimes I'll explain this to women using an analogy to a different part of the body. So if you were to come in and see me for knee pain and I looked at kind of everything around the knee and then I decided to give you some exercises for your knee, you'd probably think, well, you never even looked at my problem. So how do I know this is going to work? So it's a similar situation. If we're able to actually feel the muscles in the pelvic floor, we can give a really specialized and individual program for you. The internal exams can be done both vaginally and rectally. And we don't use speculums. So people ask that a lot as well. So typically they're a lot more comfortable than if you were to be going and getting a PAP done, for example. But again, everyone is different that way. When we're assessing for the pelvic floor, we're looking at what's the tone of these muscles. So are they tight? Are they lengthened? How strong are they? What's their endurance like? And are we able to coordinate those muscles with other muscles in our body? As pelvic health physiotherapists, we're also able to assess for pelvic organ prolapse, and we'll talk about that a little bit later. And then we're also able to actually check out some of the deep hip muscles as well. So those can often be a source of pain for a lot of women. So we take a look at those as well. For the rest of the assessment, it will look very similar to any other sort of physiotherapy assessment if you've had that before. So on this slide, we've just kind of listed what some of that might look like. So taking a very thorough history, your medical history, gynecological, sexual, bladder, bowel health. Take a look at your posture, your breathing mechanics, take a look at your back, hip, pelvic mobility and strength as well. So it's a very comprehensive assessment. So if we just go to the next slide here, I like this graphic because it kind of goes into what pelvic floor, pelvic health physical therapy is. So a lot of people think of it as Kegels and relation to incontinence and the rectal and vaginal exams. But when we look under the water and we see more of that iceberg, you can see that we do a whole lot more than just what we see at the tip and on the surface there.
Okay. So I'm going to talk about some reasons why you might consider going in to get an assessment by a pelvic health physiotherapist. I just want to point out that today we're really focusing on that pregnant or postpartum population, but I think Emma mentioned this earlier, like really any range of individuals, any gender can really benefit from pelvic health physio depending on what signs and symptoms you might be presenting with. So these are some common ones that are usually associated with pregnancy or postpartum period. But really anyone can be experiencing these. So if this is something that you kind of resonate with, then it might be worth getting checked out. So first and foremost, we have incontinence, which again just refers to any urinary leakage or fecal liquid leakage as well. Pelvic organ prolapse, so Emma mentioned that before as well. It essentially just refers to the descent or kind of dropping of any of the pelvic organs either to or past the opening of the vagina. So sometimes we see like a uterine prolapse after childbirth, something like that. That would present as like a heaviness or kind of like a pressure in your pelvis, sometimes feels like that dragging kind of feeling. You might actually see it as well when you're going to the washroom. Urinary urgency and frequency just refers to having to go to the bathroom a lot and having to go now and not being able to really hold it. So you get the urge to pee and either you're rushing to the washroom, kind of like clenching to hang on, or you might actually dribble on your way, or you might just be going too frequently. So if you're peeing more than 8 times a day, or if you're getting up in the night to pee, those are both considered excessive and might be worth checking out because you might have an overactive bladder, which is something that we can treat as well. Constipation is one that a lot of people probably don't really associate with dysfunction, but it absolutely can be. If there's a lot of tone in your pelvic floor, we're not going to be able to get a very smooth bowel movement. So if you're like really straining on the toilet and you're not finding that you're able to have a smooth bowel movement, that's something to check as well. Low back pain, pelvic pain, hip pain. Again, those muscles are just so closely associated with the pelvic floor muscles that sometimes they kind of disguise themselves as back pain or hip pain, and it could be that, or it could be also originating from your pelvic floor. Pain with sex or pain with any sort of insertion as well. So like for young female athletes, often they have pain inserting a tampon, and that could be due to that high tone in the pelvic floor. Vulvar pain, diastasis recti, which is that abdominal separation that we see pretty commonly during pregnancy. So we want to be able to really repair that and then regulate pressure in the abdomen as well. That's something we can help with. Bladder pain syndrome is associated with urination, so pain as you're going to the bathroom, or pain kind of around the bladder area. And just prevention. So if you're perfectly healthy, but you just want to make sure that things are functioning well, especially if you're pregnant or if you've had a child and you just want to prevent any of these issues from occurring, it's just great to really lay that foundation. So this is just a really quick study here. It was done out of McMaster University, and it just kind of highlights how closely associated that low back or pelvic pain is with pelvic floor dysfunction. So they had a bunch of women who were just going to physio for back pain or pelvic pain. And then they did further assessment, and they found that over 95% of them actually had some form of pelvic floor dysfunction as well. So if you're currently experiencing low back pain, hip pain, or pelvic pain, and you're getting treated for that and you're not finding that it's really going anywhere, it's not progressing, then it might be worth checking, because chances are it could be some form of pelvic floor dysfunction. Okay, and we'll just talk a little bit about what pelvic health physiotherapy might look like during a pregnancy. Just a quick overview. So women often start pelvic health physio during their second trimester to prepare for their birth and just to prepare for all the changes that come with pregnancy, as Lisa mentioned earlier as well. So some of the common symptoms that we see are the low back pain, pelvic pain or sciatica, incontinence, and pain with sex. Those tend to arise in this period. Again, they're really common, but they're not normal. It's not part of a normal pregnancy, so we should be addressing those signs if we're seeing them. Core awareness and training is super crucial in this point. Again, we're going to see a lot of changes happening to our core, which also includes our pelvic floor during a pregnancy as the baby's growing and it's kind of having those increased demands on the tissue. So we're wanting to make sure that we're prepping the core for that, and we're really like adjusting as those changes come. We talk a lot about exercise modifications too. Emma's going to jump into exercise during pregnancy and just some guidelines there. So it is very important to keep active during your pregnancy if you can. So we're a really good resource to keep you moving as much as possible and in the least aggravating way. So if you are having symptoms, we're a good resource on how to kind of get around that and stay active. We also talk a lot about how to prepare for your labor and delivery. So there's actually quite a bit that you can do to kind of take control over that process. Certain things really help with decreasing the trauma to the pelvic floor. So that would include stuff like perineal massage, which is just a technique that we can both perform, but also teach you how to perform. And it really helps to reduce the amount of tearing during your delivery. But also how to relax your pelvic floor. That's super important when you're giving birth as well, to make way for the baby. And again, to reduce the amount of pulling and tearing on the pelvic floor. And finally, we talk a lot about what you can do postpartum. So I think a lot of women kind of go home from the hospital with their new baby, and it's obviously a very overwhelming period, and they're not really sure what they can be doing safely. So again, we're just a good resource to kind of set you up for that, to know what to expect, what to look out for, and what you can get started with right away.
All right, so we're just going to talk quickly about exercise during pregnancy. So here we have the latest Canadian guidelines on exercise and physical activity during pregnancy. These were released in 2019. And in these recommendations, they have 6 things that they've highlighted. So again, just briefly, we'll go through it here. So all women without contraindication should be physically active throughout pregnancy. And this includes women who are previously inactive, women who are diagnosed with gestational diabetes, and women who are categorized as overweight or obese. So a contraindication, Dr. Liang is going to talk about those in a little bit. But just overall, pregnancy is not an exception to getting in your regular exercise. All right, next one. So pregnant women should accumulate at least 150 minutes of moderate intensity activity during the week. So this is actually really no different from what the general guidelines are for the adult population, other than the intensity piece. We just want to be a little bit more mindful of how intense our exercise is during this time. So just being able to modify that as you're going along. And as you get further along your pregnancy, that modification is going to increase. Physical activity should be accumulated over a minimum of 3 days per week. So basically just don't try to get your 150 minutes in one day. We want to really spread that out. Pregnant women should incorporate a variety of aerobic and resistance training. So both of these are safe and important for the health of both yourself and your baby. And then this one is particularly relevant to Tess and I as pelvic health physiotherapists, but pelvic floor muscle training may be performed on a daily basis to reduce the risk of urinary incontinence, and instruction in proper technique is recommended to obtain optimal benefits. Now, I just want to point out here the example they gave is Kegel exercises, but as Tess has kind of mentioned before, Kegel exercises aren't necessarily the right exercise for everyone. So coming in and seeing us to making sure you're getting the right exercise for you is very important. And then the last one here is pregnant women who experience lightheadedness, nausea, or the general feeling of unwell should modify. So again, both Tess and I and Dr. Liang are all great resources to see if you're having these symptoms and to get some modifications.
So just to explain a little bit about what Emma was talking about, essentially most things are fair game in pregnancy. You just want to sort of modify and listen to your body. It's really, really important that you do strength training and functional strength training in pregnancy, because obviously when you come home with a newborn, the baby's only going to get bigger over time. So you really need to build up your strength and keep your strength there during pregnancy if possible. You do want to modify and listen to your body. So there's lots of different guidelines talking about, maximum heart rate and all these sorts of things. I mean, I try and keep it simple when I'm counseling patients. Really what you want to do is the moderate exercise is more like a 6 or 7 out of 10 in terms of exertion. So you want to feel like you're getting to a 6 or 70% out of 100 out of what you could do. You don't really want to overdo it for a couple of reasons. One is because it can really increase your body temperature, and 2, because you don't want to max out your heart rate, especially towards the end of pregnancy. So things that you absolutely need to avoid are contact sports, hot yoga, extreme temperatures. Don't take up scuba diving or mountaineering at this time. So anything with extreme altitudes can be dangerous. You want to sort of avoid anything with a risk of falls beyond the first trimester possible, and really not the time to test out a new exercise regimen. So you do want to make sure that you're doing something that's pretty safe. If you have any questions about it, you can always check in with your family physician or physiotherapist. I think the biggest thing is people are really concerned about, the weight gain and all those sorts of things, but you just sort of want to stay active and gain weight in a healthy way, still trying to keep to that half a pound to a pound a week, and adjust your calorie intake accordingly depending on how active you are. It's a little bit hard for you to see right now on Zoom, but I'm actually in my 3rd trimester myself. This is my 2nd baby, so I do actually have some exercise modifications in pregnancy that I've been doing in this pregnancy. If you have, any interest in that, you can always check out the Instagram for some safe modifications as well. So there are a couple of absolute reasons to avoid exercise in pregnancy. I mean, these most of which are pretty rare. There are very few conditions where you have to be on bed rest. And if you need to be on bed rest, most of the time you're seeing an obstetrician at that point. So you'd be beyond a midwife or a family physician. And they would essentially advise you that you really need to be on bed rest. The majority of people, even with some of these conditions to a lesser degree, can still be active with light walking and gentle yoga and those types of things. And I think if you have any concerns, it's definitely important to talk to your obstetrician about that. But there are very, very few conditions where you absolutely cannot exercise. Really uncontrolled medical conditions or heart disease or those types of things, you can't really exercise. But the majority of women who are childbearing age don't really have those conditions. So the guidelines are pretty much, as Emma said, exactly the same for pregnant women as for the general public. And there are very few exceptions to that rule. So reasons to see your family doctor postpartum. So routine postnatal care, typically you check in at about a week and then again around 4 to 6 weeks. If you have any questions about feeding or breastfeeding, nutrition or exercise, back, pelvis, hip pain, but also shoulder and neck pain tends to flare up a lot because again, you're carrying a newborn around. Even if you're bottle feeding, you're looking down way, way more than you normally would have been before giving birth. So a lot of strain on the shoulder and neck girdle for sure. Again, incontinence and hemorrhoids, not a part of normal postpartum, despite all of the horror stories that you might see online, not a part of normal. So if you have any of those symptoms, definitely check in. If you're not, going to the washroom regularly, having issues with constipation, any of those sorts of things, definitely things you want to address early on. The longer you leave something, the harder it is to sort of treat later on. Any general health concerns, obviously checking in with your midwife or family doctor, and then just some red flags, again, just to note in case you have any of these things, check in sooner.
Okay, so let's talk about what pelvic health physio might look like after you give birth. Typically, you can really start this whenever, but we're not going to be doing any internal exams until at least 6 weeks postpartum. That doesn't mean that you can't come in and get things checked out anyway, just with like the abdomen and general like exercise counseling and that kind of stuff. However, yeah, 6 weeks is normally kind of when we would start this up, but it's never too late. So if you're still dealing with symptoms down the line and you haven't addressed this before, there's always capacity for the tissue to improve in terms of like strength and coordination and all that good stuff. So never too late if you are experiencing these things down the line. But again, we're going to dive into some of the common symptoms that we tend to see in this timeline. So we've mentioned these a few times now, but the low back pain, pelvic pain, sciatica. Dr. Liang just mentioned the neck and shoulder pain, and we'll get into that a little bit more too. There's a few reasons why that happens in that time period, and that's something we can absolutely manage. Incontinence again becomes a bigger, more common issue in this time period, so we definitely want to get on top of that. And pain with intercourse and pelvic organ prolapse. So this is a time period when we're really going to be educating you on what to look for in terms of those symptoms so that you can address them quickly and then get on top of it. Core retraining is vital, especially when you want to get back to exercising. We really need to build that foundation first. We need to make sure that your pelvic floor and your core can really handle the pressure that we're putting on them. So with exercise, we get that increase in pressure. So we want to make sure we're really building that core beforehand. Something that becomes more important in this period too is scar tissue management. So whether you have a tearing in your pelvic floor or a C-section, we want to make sure that that scar is healing really nicely. It's also really important to make sure that the tissue underneath it is still able to perform well. So that's one of the reasons why we really want to take care of that. And then general guidance for getting you back to your daily activities, especially exercise. So again, if you're dealing with any symptoms, we're a great resource on how to modify to make it more comfortable so you can stay active. But we can also make sure that you're really taking a good gradual approach. Now that you're postpartum, no longer pregnant, at this point, you want to eventually be getting back on track to that higher intensity or higher impact activity, but we're not just going to go from doing nothing to that. So we want to take a really steady, gradual approach, and that's something we can guide you through. And just quickly, just another study here that kind of shows how common that neck and shoulder pain is postpartum. A few reasons for that, like Dr. Liang mentioned, would be looking down at your baby a lot, more caring and they're only getting heavier, she mentioned as well as breastfeeding postures and just general changes in body mechanics and weight distribution. So we can do lots of postural assessment and really train our postural muscles to make sure that we're kind of countering that.
All right, so we're going to talk about returning to exercise postpartum. So I get really excited about this topic because the first ever set of guidelines for women returning to exercise postpartum were released in 2019. This first slide here is going over what exercise may look like in the first 3 months. What I just wanted to highlight is that often women are kind of in the dark in the first 6 weeks before they get cleared by their OB or their midwife to kind of return to everyday life. But that doesn't mean you can't do anything. So you can see here, even within the first 0 to 4 weeks after you give birth, going on some walks and doing some basic core exercises, and then just doing some exercises that mimic functional requirements of day-to-day life as a mother. So once you give birth, it's not like you're completely resting. Like you have to squat down to pick up objects, to pick up your baby. So if you're doing that in your day-to-day, then you can do it as a light form of exercise as well, again, as you're monitoring your symptoms. And then we just progress as we go along. I'm not going to go through all this, but if you have any questions, I'd be happy to answer them. So once we get to the later postpartum period, we can start to think about returning to high impact exercise. So I'll go into what high impact and high intensity exercise is in just a minute, but I just wanted to talk about some considerations when we talk about returning to this form of exercise. So we want to be at least 3 to 6 months postpartum. And this is because we really just need to let the tissues themselves heal. So you can be as fit before and during your pregnancy, but when you're giving birth, whether that's vaginal or whether that's by cesarean section, there is some changes to the tissues and we need to let that heal with time. So we take into account your previous level of fitness, what your activity level was like during and before pregnancy, what your birthing method was, what complications you had, and then just what is your core and your lower body muscle strength and endurance like as well. So here, just briefly, high impact exercise basically just refers to any form of exercise where there are higher amounts of force between your body and the surface you're exercising on. So this includes exercises like running, jumping, plyometric training, if you're into CrossFit, Orange Theory Fitness, F45, those are all examples of what might be high impact activity as well. And then we can compare that to high intensity exercise. So this varies slightly from high impact exercise as it refers to more of a vigorous state of exercise. So Dr. Liang kind of made a note to that moderate intensity exercise when we were discussing exercise during pregnancy and how we can measure that on a 0 to 10 scale. So that's a really nice way to assess it. If you're in a more complex setting, sometimes we can look at heart rate, but again, not too practical when we're in the clinic here. Or the talk test is a great way as well to know how intense your exercise is. So if you can talk but not sing during an exercise, you're probably at about a moderate intensity. And if you can't get more than a few words out, then you're at a high intensity that way. So just to make sure we're all on the same page, running, for example, is a high impact and can be a high intensity exercise depending on how hard you're running. Whereas something like cycling or even going on an elliptical can be high intensity if you're really getting your heart rate up, but it's not high impact because we're not getting that pounding force through our feet as we go through that. So some things to keep in mind when we're figuring out how to return to exercise postpartum. So in terms of what we look at as pelvic health therapists, and this is actually more of your checklist as the woman who's postpartum, you want to make sure that you're not having any of these as you start to return to your high impact activity. So you don't want to have any leaking of urine or feces while you're working out or after your workout. You don't want to be having any feelings of heaviness or pressure in your vagina. You don't want to have any onset or ongoing bleeding. So that's not related to your menstrual cycle. So if that's happening, you'd want to check in with your doctor. And then you don't want to have any pelvic pain or low back pain during your exercise as well. And then when you see us as pelvic health therapists and we're doing an internal exam, what we're looking for is, do you have adequate pelvic floor strength? Do you have adequate pelvic floor endurance? Do you have a negative pelvic organ prolapse assessment, or are you able to monitor your pelvic organ prolapse symptoms and control them? And then we don't want to see any evidence of incontinence during those exams as well. All right, so these are just some tests to kind of see where you're at in terms of your pelvic floor health. So you should be able to perform these tests without any pelvic or low back pain, heaviness, dragging, or incontinence. So I won't read them all out, but some examples are just walking for half an hour and doing some hops. So those are all great tests. And then last but not least, we want to see what your strength is like in some of your lower body muscles. So weakness in these areas does not necessarily mean you can't exercise, but it is useful to identify weaknesses and areas for improvement. So when we take into account the gestation of pregnancy and the time needed for our tissues to recover after delivery, we're looking at over a year of lower intensity and lower impact training and exercise modifications. So your muscles are not as strong as they were prior to pregnancy. So if we go back to high intensity, higher impact exercise without proper graduated training, we're putting ourselves at risk for other types of musculoskeletal injuries that might not be related necessarily to your pelvic floor. But the last thing we want is to send you back and then you come back and see us with a knee injury. So that's something that we take into account as well when we are returning to exercise. All right, so that includes the main content of our presentation. I know there was a couple questions in there, so I guess we'll just kind of scan those and pick which ones we want to answer. I mean, we'll answer all of them, but who's going to answer which ones? All right, so I'll just start with one that I just noticed here, and I'll let Tess and Dr. Liang kind of see if there's any that they feel like they would be best at answering. I just saw one here. How long after giving birth do you suggest initiating this? I can't really tell what part of the presentation we were at, but if we're talking about pelvic health physiotherapy, I think Tess mentioned internal exams. We want to wait until you're cleared by your doctor or midwife before we look into doing anything that way. But if you're having symptoms, it's never too early to come in and get them looked at. And we can definitely offer suggestions and tips to help to manage your symptoms that way.
Mm-hmm. I'm seeing one here. I started having hip bone pain for the past few weeks. I'm week 21 now. Is that related to pelvic health? Will Kegel help my hip pain? The kind of short answer for that is it's hard to know without an assessment, honestly. There's several different possible origins of hip pain. So whether it's just actual tension in some of the muscles that surround the hip, whether it's tension in the pelvic floor or something else kind of related to mechanics or other. It is tough to know that without an assessment, which is why we say, we're not going to just give out Kegels to everyone because we don't know that that's going to necessarily help your pain. Typically what I'll say, I guess, I mean, you can correct me here if I'm wrong on this, but like, if you're seeing someone for the first time and the main complaint is pain, we're probably not going to start with Kegels. You kind of want to down-regulate the nervous system in that sense. So we probably start with actually a lengthening exercise, which can be a lot of things, but some helpful ones are like very gentle stretches for your hips and low back. So something like a child's pose and focusing on lengthening your pelvic floor as you inhale would be something we might start with. But again, it's impossible to know without an assessment. I just would think we wouldn't probably start you on Kegels if it's a pain complaint.
Yeah, I'd have to agree. I mean, I think the biggest thing would be, as you said, there's lots of different pain generators. It could be, right? Could be coming from the joint above. So the back could be coming from the joint below the knee. So we'd have to kind of do an assessment that way to know. But yeah, we probably, as you said, test soft tissue work and lengthening and stretching and trying to reduce pain first before jumping into strengthening.
Mm-hmm.
I'm just looking to see I had a private message that was asking about just chronic symptoms in general and just when to check in. And I think the answer to that, just to speak generally and not give anything away, is just to check in sooner rather than later. I think, obviously things can change over time and your symptoms might come and go over time, but I think consistent symptoms of anything in terms of incontinence or hemorrhoids or anything like that is definitely a reason to check in with a physician sooner rather than later. Most of these chronic issues, although they take longer to resolve, they can get better. It just needs a little bit more diligence and follow through in terms of longer courses of treatment, but they're still very treatable conditions.
So I see a question here. What is scar mobilization? So scar mobilization is just a technique. I explain this to patients. Our scar tissue is different than just regular connective tissue. It's a little bit stickier. So it can adhere to tissues around the scar, and it could limit the way our body parts around the scar function. So with scar mobilization, it's a progressive technique. So it depends on how sensitive the area is around the scar, but basically we're just trying to get that tissue moving a little bit. So we'll do a little bit of massage around the area with different techniques, and just basically just trying to encourage that tissue to move more, because the more movement we can get out of the scar, the better you'll feel around the scar. Another question here, is pelvic health physio covered by Ohip? That's a tough one. So for physio, there are Ohip clinics. So that would cover people who are over the age of 65 or under the age of 19, I believe. Not all physio clinics accept Ohip, but you'd have to check. I'm not sure how many Ohip clinics actually have pelvic health physiotherapists available. So you'd have to check in with your local clinics and see if they have a pelvic health therapist that would offer it through that clinic.
Yeah, pelvic health physio is just in the general category of physiotherapy. So if you have private insurance, it would be covered. But yeah, OHIP only covers certain conditions if you're between 19 and 65. They're very specific conditions. So you can always research if you meet any of those criteria. There is a list of OHIP covered physiotherapists online as well. You can always call those clinics to inquire. But as far as I know, there's nothing in like Burlington, Oakville, Saga area that they don't have any trained pelvic floor physiotherapists at OHIP clinics.
Thanks, Lisa, or Dr. Liang.
Yeah, we are doing virtual appointments as well. I just saw that question there. Again, we get a more accurate picture when we can do the in-person assessment, but of course with COVID and all of that, it's understandable that some people feel safer at home. So we do virtual consultations as well.
So there was a question about, I think someone who's currently pregnant. So she's 33 weeks and just asking about incontinence following another pregnancy. So good question. In terms of how babies sit, so babies tend to sit obviously a little bit lower every time you are pregnant. So that could be the reason why you're feeling maybe more symptoms during your second pregnancy. Typically, if you mentioned that you had a toddler, so typically I would expect that you would have recovered from the first pregnancy in the meantime, because most women would be able to do a course of physiotherapy and sort of get things back on track. But if you feel like you never fully recovered, then I do think that's a reason to check in with your family doctor just to discuss that, because obviously those symptoms are something that should improve with treatment and not necessarily get worse. Obviously, if you're pregnant again, all of those factors come into play in terms of having looser muscles and pelvic floor in general. But then once this pregnancy is over, definitely would recommend, checking in again to make sure those symptoms have resolved. And it's still worthwhile to see a pelvic floor physiotherapist, obviously during pregnancy, to try and manage some of the symptoms that you're having, right now.
So there's another question in the chat too, another postpartum question. 10 months post-vaginal delivery, there was some tearing there and currently having some pain with intercourse. So they're just wondering whether that could be scar tissue causing the pain or seeing if maybe there was an extra stitch in there. So I don't know, Dr. Liang, if you have any notes about that extra stitch, because that's more of, I guess, a doctor thing. I don't think that's routine practice. Isn't it called like the husband stitch or something? But I'll just say my part and then you can kind of jump in. But it definitely could be the scar tissue. I see that a lot. So if you're comfortable, sometimes I'll recommend, like, if you have like an unscented oil, like coconut oil is actually good for around the perineum. So not actually putting it into the vagina, but around the perineum, just working on that scar tissue. Another common thing that can cause pain with intercourse after delivery is overactive pelvic floor muscles. So we talked about that a little bit. So working on lengthening those muscles and relaxing those muscles can help a lot with intercourse. But Dr. Liang, I don't know if you wanted to have any anything there.
Yeah, so having seen a fair share of vaginal deliveries, I've probably seen around 200 deliveries during my training. I would say that it's sometimes very hard when we're doing repairs to kind of make sure everything looks perfect as it did before. And sometimes there is extra tissue, and it's sort of up to the person who's repairing you as to what to do with that tissue. And so sometimes they do end up sealing it, and it ends up being an extra little stricture. I've seen that a couple of times actually. So oftentimes they do recommend, they might recommend that you see a pelvic floor therapist. Sometimes estrogen to help soften the scar tissue in the area can be advised by your OB or by your family physician. And it does tend to resolve. So that tissue does tend to recede a bit if we use estrogen. Sometimes people use dilators. We should return back to what is normal, but if there was too much tissue that was too tightly sealed together, or there's too much scar tissue, sometimes you do need to have the OB or a family physician remove that extra piece of tissue. It's pretty rare for that to happen. I haven't seen it happen very frequently, but if you're someone who's tried those other treatments for a couple months and it's not really getting better, then that might be something that you might need to explore. Again, most of the time, the elasticity and all those things does come back with topical estrogen and pelvic floor therapy.
Great. So there are quite a few questions here. I don't want to keep people on too long. I don't know if we just want to do one more quick scan, but otherwise, Tess, I don't know if you just want to go to the next slide here. So all three of us actually have Instagram pages, and we're all available to message over Instagram if you have any questions. Or all work out of a clinic in Burlington as well, and we're all taking appointments currently. So if you have any questions or concerns that we didn't answer today, feel free to give us a follow on Instagram. We all post content similar to what we presented today. Dr. Liang mentioned she's herself is in her third trimester, so she's posting a lot of things relevant to today's topic as well. So if we didn't answer your question, feel free to reach out to us that way, or you can give us a call at our clinic as well and book in with us, and we'd be more than happy to help you that way. All right. Tess, Dr. Liang, did you have any other things to cover before we close up here?
No, I think that was great. Thanks everyone for coming out. That was